Hello and good evening, everyone. It's 5 p.m. UK time. So, as you know, tonight we are starting a little bit earlier with our first webinar and with our first guest tonight. And I'm sure you are quite familiar with our guest tonight. This is Andreia Trigo. Hello, Andreia. How are you feeling tonight?
Hello, thank you so much. I'm feeling great. Thank you so much for inviting me to be here today.
We are definitely delighted to have you back as our presenter. And of course, you have brought another interesting topic. So thank you so much for that. And as you know, we will be here. We are here every single day from Monday till Friday to support you, to give you opportunity to ask your questions to top fertility experts, but also some people like Andreia who are here to support you to also answer your questions. And well, as you know, all those events have been brought to you also through our thanks to our partners and ambassadors. You can see them right here. And as you probably know, Andrea is also our ambassador here. So thank you so much, Andrea, also for supporting this initiative once again, as this is our second edition. You have been part of it from the very beginning. So thank you so much for that. It means a lot for sure. And as you can see, of course, we will start with Andrea's presentation on modifiable factors that improve IVF outcomes. And Andrea will be talking about this. And of course, afterwards, it will be time for your questions. All you need to do is just type those questions in the chat section. And of course, she will be more than happy to help you out as always. And just let us know that you can hear us. And well, I believe we can go ahead with the presentation. Right, Andrea?
Right. Thank you so much for the lovely introduction. And it's a pleasure to be here today to talk about the modifiable factors that improve IVF outcomes. I'm very passionate about this topic because I feel when we're trying to conceive, so many times we feel loss of control. So I'm very passionate about giving back the power so that you can modify what you can, so you can have a say in whatever outcome you have out of fertility treatment, but also to empower you with the knowledge so that you don't have to change the things that don't have a difference when it comes to your fertility treatment. So I'm super passionate about this, and I'm so excited to share some new information with you today. But because we're going to be here for a while, for those who don't know me, I thought it would be interesting to tell you a bit about myself. I was diagnosed with infertility at a very young age. I was just 17, and I was waiting for my periods to start, and they weren't starting. And that's when the doctors diagnosed me with a condition called MRKH, which means that I don't have a uterus. So at the time, it was very difficult to cope with the challenge of infertility. It took me almost 15 years to be emotionally okay and to want to work in this area as well. So now I see it almost as my driving force for everything that I do. And I wouldn't have it any other way. But it took me a long time. And I made my mission to want to give back some of the tools that I've learned along the way to other people, because when you are diagnosed in your 30s, you don't have a decade like I did to reflect about the consequences of not being able to have children naturally and quickly like we thought we would, and still make really important decisions about your reproductive future. So I felt it's almost my mission to give back some of the tools that I learned along the way. And I decided to combine that with my professional experience of being a nurse consultant as well and coach. It was when I decided to embrace my mission and my own journey to grow beyond it that everything started to unravel for me. When I did my TEDx, written a couple of books, and then created the Enhanced Fertility Program. And the information that I'm going to present to you today is part of this Enhanced Fertility Program. There is something awesome that I want to tell you by the end that is coming next Monday. And I want you to invite all of you to be part of this amazing movement that is coming. So stay tuned until the end. Today, we're going to talk about modifiable factors. And I can't talk about all the modifiable factors that matter when you are having fertility treatments. But here in this hour today, I would like to talk about 6 of those modifiable factors that matter. And I will tell you a bit about each of them. We want to talk about the impact of your lifestyle on fertility and conception, because a lot of those modifiable factors are related to lifestyle choices. And we want to talk about available evidence and current recommendations, because we want to make changes that have been proven to be actually beneficial for you and not changes that have worked for one person. And that takes me to this next slide. So this pyramid is what we call the quality of evidence of research in medicine. As you can see, there are different types of research papers available, research studies. And at the top, we have meta-analyses, systematic reviews, randomized controlled trials here in green. So these are very high quality studies where you have, for example, a group of people undergoing one intervention and a group of people who are going a completely intervention or no intervention at all. And the results are compared, and there is a statistical difference in in one of the groups. So we can say that that intervention was actually beneficial or not. And then you have very low quality studies, which are, for example, individual case reports of this is a study where it's just one person who did something and then she eventually, for example, got pregnant. So we don't know if there was chance or if it was actually that intervention that led to the outcome of pregnancy. So whatever we're doing when we are trying to conceive, if we're making changes to our lifestyle, we want to make sure that the changes we're making are based on high quality research, randomized controlled trials, systematic reviews, meta-analysis, meaning that they have worked for a lot of people and not just someone else who has done something and then it worked for them. So all the information that I'm going to present to you today are from these high quality studies. So I invite you to challenge everything that you are told or everything that you read online and check the source. What kind of research was behind the information that I'm reading today? Don't take everything for granted. So it was my passion for research and wanting to give people something that empowers them to make changes that are evidence-based that led me to finding actually 22 modifiable factors that can make a difference when you're trying to conceive. So all of these factors are factors that I talk about in the Enhanced Fertility Program. And today we're going to cover 6 of them. We're going to talk about weight, nutrition. I know it's 2 factors that a lot of people struggle with. We're going to talk about physical activity, caffeine, alcohol, and mindfulness. I try to choose things that are common, that a lot of people might be thinking about, or maybe they have tried to change. And I think hopefully by the end of today, you will also be able to learn more about the other modifiable factors, but I'll tell you more about it as we come to an end. So let's start with the weight issue. And around 70 to 80% of people I come across, they have been asked to either lose weight or gain weight in order to improve their fertility. However, they haven't been given a process or a support mechanism to help them lose that weight or gain that weight. So it can be incredibly difficult to adjust your weight. But again, it's something that a lot of people are faced with. And there is some research on it. In fact, the weight does matter when you're trying to conceive. And there's what we call the fertility zone for weight, which is a body mass index between 20 and 24. So if you are between 20 and 24, you are more likely to be able to get pregnant. So I don't know if you have ever been able to identify your BMI. If not, then all you need to do is you go on Google and you type BMI, and there is a calculator where you're able to introduce your weight and your height, and it will give you a number. Or you can find a table like this one where you have your weight at the top, you identify your weight, and on the side you identify your height, and where they cross, it will be your BMI, just to see if you are in that fertility zone for weight. What research shows is that there is a risk of infertility that is highest amongst those that are at the lowest and at the high ends of the BMI distribution. So those that are here, that are at the low weight or at the high weight, tend to have more problems with fertility. And research also shows that there is a risk of ovulatory disorders in women who are classified as underweight, so a BMI below 20, or women who have obesity with a BMI over 30. Ovulatory disorders are problems where you are not ovulating or you're not ovulating regularly. So I decided to bring here some of the evidence for both low and high BMI. So we have here low BMI, and there's a higher prevalence of poor quality eggs and a strong trend towards having less eggs retrieved compared to women who have normal weight. And other studies showed a reduced probability of achieving pregnancy, an increased risk of miscarriage, and a reduced live birth rate. So there is a few things to make note if you are underweight. On the high-end BMI, we have some research saying that fertility is affected by an increased BMI, both in men as in women. BMI between 30 and 35 was associated with greater odds of failing to achieve a clinical intrauterine pregnancy compared to women who had a lower BMI between 18.5 and 25. And in women, obesity was associated with anovulation, which means when you stop ovulating, with menstrual irregularity, so your cycles are not regular, but also with impaired egg development and quality and embryo quality. And for men, there is less available data when it comes to weight and fertility, but observational studies have suggested that possible contributing factors may be either increased testicular temperature when sitting, and testicular temperature is one of the other modifiable factors. It tends to be very important because sperm doesn't like high temperatures. Increased estrogen production in adipose tissue, and reduced sperm count and motility. So there's a few things that we need to be aware of if we are both underweight or overweight. And I understand it can be really hard to lose weight if we are overweight, or to gain weight if our body has always been skinny. But it's important to notice if you're having any of those other signs. Are your cycles regular or irregular? Have you noticed if you have an LH peak, are you actually ovulating or not? So regardless of your weight, if everything is okay, you might not need to lose or gain weight. But if you notice that there are certain irregularities, then maybe there's something that you need to do about. You need to do something about it. And it might be that adjusting your nutrition is one of the ways of gaining or losing weight to move closer to that BMI of 20 to 24. And there was a big study, which was called the Nurses study by Harvard University, where they followed a lot of women throughout their lives, a lot of years, and they were trying to identify, when it comes to nutrition, what matters if you're trying to conceive. And there's 8 things. I'm not going into detail about nutrition here today because I really want to cover the 6 factors, but I want to talk to you about the 8 things that came out of that study. Number 1 has to do with trans fats, and we need to avoid trans fats. Trans fats are hardened vegetable oils that we use, for example, to fry food, or that we use, for example, to bake cookies or cakes, everything that is hardened vegetable oil. So if you think about cakes, biscuits, burgers, pizzas, all of that has trans fats. And the problem with trans fats is that it accumulates the fat in your arteries, and it increases the bad cholesterol and reduces the good cholesterol. The good cholesterol in your body helps your body get rid of the bad cholesterol. So if you have more of the bad and less of the good, you can see it's not going to turn out so good. The fat in our arteries prevents our main organs to receive enough oxygen and enough nutrients. When one of those arteries or micro arteries or vessels are blocked and we stop getting some of that oxygen supply, if it happens in our heart, we can have a heart attack. If it happens in our brain, we can have a stroke. But when it comes to our reproductive organs, if there is fat in the arteries that are supplying oxygen and blood supply to these organs, like our ovaries and our uterus, then the blood supply might be limited. So one of the key recommendations of this study is to avoid trans fats in our diet. So if you can identify, if you think about what you've eaten today, yesterday, over the weekend, and have you had a lot of trans fats? So is that maybe something that you could change? The second factor they have here is that we need to use more unsaturated vegetable oils. So these are the good vegetable oils. And vegetable oils can be found in nuts, seeds, cold water fish like salmon and sardines, avocados. So we need to introduce more of these in our diet. The third recommendation is that we need to turn to vegetable protein. This study actually identified that women who were eating more vegetable protein were more fertile than women who were eating animal protein. So we're talking about eating more broccoli, figs, avocado, peas, and spinach. For example, instead of eating animal protein at lunch and dinner every day, why not replace one of the portions of animal protein by vegetable protein? Now, number 4 has to do with choosing the right carbs. And I know that a lot of women or couples, men who are trying to reduce weight, they might want to avoid carbs altogether, but our body does need carbs. So it's not a matter of avoiding all carbs. It's just a matter of choosing the right carbs to eat and to introduce in our diet. We have simple carbs or complex carbs. Simple carbs are absorbed by your body very quickly, transformed into sugar. So you have a peak of sugar in your bloodstream and then a very quick drop, and you will get hungry very quickly again. Then you have slow carbs. Slowly absorbed carbs are more stable. So these ones are found in whole grains, vegetables, whole fruits, and beans. So if you're, for example, eating pasta, for example, if you eat whole grain pasta as opposed to white pasta, or whole grain bread as opposed to white bread, or whole grain rice instead of white rice, that's a simple change already that can make a big difference in your fertility. Now, recommendation number 5 has to do with milk. And actually, this recommendation, they are not so sure why it happened. They just know that that is the case, that women who were drinking whole milk were more likely to get pregnant. So the recommendation is to switch to whole milk when you are trying to conceive. Even though we know that whole milk has more fat, we don't know why it seemed to be better for fertility. It's just one of those findings that they noticed when they did the study. And it might be, it's their hypothesis, it might be that whole milk is a less processed form of milk, because in general, foods that are more processed seem to be worse. And they are worse because they have more refined sugars, more fat. So everything that has been through a lot of processing systems before it gets to your plate so you can eat it is bad. So you want to choose foods that are the least processed as possible. So if we are looking at these lists here and we're talking about broccoli, figs, avocados, spinach, If we're talking about fish that you just need to grill and you don't do anything else with it. So all of these foods are have very little processing. Then we have here number 6 is taking a multivitamin, especially folic acid. Folic acid is important, and it's important to prevent spina bifida defects, which are defects that happen in the spinal cord of the baby very early on during the conception phase. So every woman who is of childbearing age who may get pregnant should be taking 400 micrograms of folic acid and eating a diet that is rich in folate, which is a natural form of folic acid. So all those dark greeny vegetables will give you all the folate you need for your needs and your baby needs. And number 7, get plenty of iron from plants. So here we're talking about whole grain cereals, spinach, beans, pumpkin, tomatoes, and beets. And this seems to be particularly important for 2 factors. One, to prevent anovulatory infertility. So anovulatory infertility, I said it before, is when your ovaries are not ovulating. And secondly, it's good to prevent anemia when your blood count is low. So get plenty of iron from plants. And the recommendation number 8 is about drinking water. Water seems to be the best fluid to drink when you're trying to conceive and in life in general. So these recommendations that have been found to be good for your fertility, I almost like to think about them as a plan that you can almost maintain for a healthy life. That is healthy for now when you're conceiving, but it's healthy when you're pregnant, and it's healthy when you have a baby because you want to pass on what it feels like to be healthy to your baby, so your baby starts learning from a young age what it feels like to have a healthy lifestyle. It's giving babies the best possible start in life. So the next step, I would say, if you're making some of these changes, maybe start by noticing what you're eating first. If you look at your whole week, your food plan, and you notice this is what I've eaten, maybe notice what can you change that's not going to change your life dramatically, things that you can do that maybe won't be a massive change, but still can make a big difference in your fertility. And then you can make a plan for the following week with those changes. So you have a plan and not just be told just lose weight without having any support about it. The next thing that can be quite powerful as well has to do with physical activity. And our bodies were made for moving, but so many of us spend our whole days sitting on front of our computers or not being too much active. And this is what we call sedentary behavior, when we spend very little amounts when we're spending more time sitting than moving or standing when we are awake. We also need to make a difference between what physical activity is and what exercise is. So physical activity is defined as any body movement that is produced by our muscles that requires energy. So every time we're moving, we call it physical activity. Exercise is a bit different, it's a subset of physical activity, and it's something that is planned, that is repetitive, and that is structured. And here we're trying to improve at least one component of physical fitness. So, what has research shown about physical activity and fertility? And what we know is that too much physical activity is bad for fertility. So, what is just right? And I know this can be a bit tricky, but I'm going to bring you here some studies about what is just right. So, this study identified that vigorous exercise of 30 to 60 minutes a day was associated with reduced risk. Another one, moderate exercise decreased the risk of miscarriage and increased the chances of having a baby amongst women who underwent fertility treatment. The other study, a minimum of 1 hour exercise 3 times a week, improved rates of implantation in pregnancy and reduced the risk of miscarriage in 436 women who had ICSI. And in another study, low to moderate exercise was also associated with increased implantation and live birth rates in 131 women who were undergoing assisted reproduction techniques. So there seems to be a need to be involved in some sort of moderate exercise. And here we're talking about 30 minutes a day of moderate exercise, not too strenuous exercise, moderate exercise 30 minutes a day or 60 minutes 3 times a week. So things that you could potentially include in your new daily activity is a 30-minute walk, practicing some yoga, for example, dancing, leisure bike riding, aerobics, jogging, and swimming. Things that are important to avoid are hot yoga, especially for men, because sperm does not like heat, bootcamp training, extreme running, or any type of vigorous or strenuous training seems to be bad for fertility. So just look at what you've been doing over the last couple of months. Have you been spending 30 minutes a day physically active? Or is there anything that you could do to change that, to move you closer to your fertility zone for activity? Are you starting to have a plan over where you are in terms of your weight, what you're doing in terms of your nutrition, and what you're doing in terms of your physical activity? So these are powerful things that you can adjust in terms of your fertility. And then that brings us to our next modifiable factor. And here I'm talking about caffeine. And caffeine, I think, is a beverage that most of us will indulge in the morning. It's one of the most psychoactive components that there is. A lot of people feel they need caffeine to wake up or to get started with their day. It is found in more than 60 plants, and after it enters the body, it is easily distributed and it exists in our saliva, breast milk. It has been found in embryos, neonates. It passes membranes, including placenta. And it's important to remember that caffeine is not only present in coffee, but also in tea, chocolate, cocoa products, soft and energy drinks. And I decided to add here this table. So this table, you can see the food and beverages here on the left and the caffeine content here on the right. So here, for example, filter coffee, 200 milliliters has 90 milligrams of caffeine. An espresso has 80. If you drink black tea, 50. Green tea, 24. So you can see that you can already start making some choices. Maybe you can replace some of the caffeine that you're drinking, for example, for green tea. So there's lots of information there for you to make empowered choices. The research around caffeine and fertility treatment is not completely clear. So there are some studies that have found that women who drink large amounts of caffeine may take longer to get pregnant. So the current recommendations is that if you're trying to conceive, or even if you're pregnant, you shouldn't drink more than 2 cups of coffee per day. And just be mindful that if you're drinking green tea, milk, chocolate, those things also have caffeine, so try to balance it out. So again, just another thing to make a note in your notepad. How is your caffeine intake? Is that something that you need to adjust, or is it something that you are nailing it already? Then the alcohol. I know it can also be challenging for some people to avoid alcohol. Research shows that heavy drinking increases the time it takes to get pregnant and can affect the developing baby's health. So the current recommendations for women who are trying to conceive is not to drink alcohol, and that has been the safest option. And the recommendation by the NHS is that men who are trying to conceive should limit alcohol to no more than 14 units a week. and this should be spared evenly over 3 days or more. Now, these are the current medical recommendations. However, if you do have one glass of wine here and there, I don't think it's going to make a major difference, but definitely alcohol can make a difference in sperm and eggs. So it's up to you to decide if you want to follow the guidelines. But I think one glass here and there is fine. But the current regulations or the current recommendations are to avoid alcohol if you're a woman, and if you're a man, to limit the amount of alcohol to no more than 14 units a week. That takes me to the sixth modifiable factor that I wanted to talk to you today. And I chose mindfulness to bring you today because making all these changes in our lifestyle is incredibly hard. I think all of us have tried at some point to make a change, and then we haven't been able to follow through, or it was a change that wasn't sustainable over time. So mindfulness can be incredibly powerful with helping us make these changes that we are wanting to make in our lives, almost like allowing us to make a purposeful choice about what we want to do with our health, who we want to be as a person. So mindfulness can help us with that. In terms of mindfulness, it's usually described as a process of paying attention in the present moment, non judgmentally. And this is incredibly important because imagine you are noticing in the present moment and you're noticing, oh, you've been eating that chocolate cake and you're stupid, you failed. So when you're saying those things, you are already judging yourself. So noticing in the present moment, non judgmentally, not judging yourself, to allow the unfolding of the moment by moment experiences. So you are noticing what is happening around you, you're noticing your feelings, your emotions, your actions, but you're not judging, just noticing. And it's important because so many times our mind is thinking about the future that hasn't happened yet. So we're really struggling, really stressed, or really sad because we are not in this present moment. We're thinking about all the other things that maybe are going to happen, but maybe they are not going to happen. So bringing our mind back to the present moment can be incredibly powerful. And so this emotional adjustment in couples with infertility is complex, and maybe some of you might be able to relate to this. So many of you might be facing stress because of the diagnosis that you've received, or maybe you're facing an identity crisis. Who am I? Am I really a woman? What does it mean if I'm not able to be a mom? Or maybe you're dealing with the ongoing fertility treatment, or you have a high possibility of unsuccessful treatment cycles. You know, if the cycles only have a 30% chance of being successful, how do you cope when it's not successful? Or you have to deal with choosing different treatment options, or you have to cope with the uncertainty of outcomes when you're having cycle after cycle, or you have to cope with unwanted effects or repeated treatment cycles, multiple gestations, high rates of miscarriage, limited live birth rates, other risks. So there's so many things that you need to cope with that it can almost seem overwhelming when we put it in a bullet point like this. But mindfulness can help with that. So there is evidence that mindfulness in a specific format that we call mindfulness-based interventions can have a positive impact on people's experiences of infertility. So these consist of one session per week, and the duration may range between 8 to 12 weeks. And this seems to be really beneficial. So what does it do for people who are trying to conceive? So by the end of the intervention, women who have been through this program revealed a significant increase in mindfulness, self-compassion, meaning-based coping strategies. And this is important because so many of the coping strategies that we have are usually not based in meaning or self-compassion. Our strategies might be around avoidance. I want to avoid pregnant women. Or my strategies might be drinking more alcohol or eating more chocolate. So going through mindfulness can help us increase these good coping strategies that are aligned with what we want to achieve. And inversely, these people also presented a significant decrease in emotion regulation difficulties, meaning it was easier to cope with your emotions. And there was also less usage of active and passive avoidance coping strategies. So you don't feel that you need to avoid things to cope with your challenges. So it can be very, very powerful. The study showed that there were significant differences between participants in the pregnancy rates as well. So this is incredibly powerful. So after going through this mindfulness-based intervention, at 6 months after the intervention, the ones who had gone through mindfulness were more likely to have become pregnant, 45%, than the controls at 26%. So this is incredibly, incredibly powerful. And it might be that just because you're mindful, you're more likely to have behaviors and lifestyles that are more aligned with what your body needs to get pregnant. So all the other things that we're talking about, the nutrition, the weight, the caffeine, the alcohol, all of those things become a bit easier to change when we are practicing mindfulness. So other outcomes that are really important, because we all want a baby at the end of the journey, but I usually say that that is not the only thing that matters when you're going through this journey. Your quality of life matters. Your experience going through it matters. So when you go through mindfulness-based interventions, it has been shown that it improves infertility-related quality of life, it enhances awareness, increases acceptance, and a regained control over life. It has also been shown to improve psychological well-being, including self-acceptance, positive relations with others, and so many of us need positive relations with other people because it can be so isolating. It improves autonomy, environmental mastery, purpose in life, and personal growth. Another study showed that women who attended the program revealed a significant decrease in depressive symptoms, and we know that almost 90% of people who go through fertility treatment have some depressive symptoms. It's quite a lot. It also improved internal and external shame, entrapment, and defeat. And inversely, they presented statistically significant improvement in mindfulness skills and self-efficacy to deal with whatever infertility brings at them. Mindfulness-based interventions also reduced emotional distress, your perception of pain, depression, and anxiety in a study after 3 to 6 months of continued practice. And women in this other study, in the intervention group, had a significant decrease in anxiety, depression, stress, and were 4.5 times more likely to become pregnant than those in the control group. So there's all sorts of results here that I thought it would be really interesting to bring to you. And what I want you to do now is to think about ways that you can use to introduce mindfulness into your daily life in a way that is not very different to what you're doing. Start by doing something very basic and simple. For example, brushing your teeth every morning. You're going to brush your teeth mindfully. You're going to notice the toothbrush. What does it look like? What is the color of the toothbrush? What does it taste when it touches your mouth? And then you move on to, for example, breakfast or lunch, and you're going to do mindful eating. What does your plate looks like? What colors do you have on your plate? What textures do you have on your plate? What does it smell like? What does it taste like? And then you can start doing, for example, when you go for a walk, some walking mindfully. What is the pace of my walk? Do I feel the ground as I step in? Is the sun hitting my face? So all of those things are mindfulness. You don't necessarily need to be sitting down, closing your eyes to practice mindfulness. So if you haven't done it ever, introducing it slowly through your daily activities is a very easy way to do. If you have already done that or you're already doing that, I think the second thing that you could do is start listening to some mindfulness recordings. And there are several available on YouTube all over the internet that you can get. But everything that helps you focus on what you want to achieve, maybe you want to focus on the fact that your body is healthy, that you have the confidence, the love, the power, the strength to cope with whatever the day throws at you, that whatever, no matter what happens today, you have the energy to move one tiny step closer to your goal, to make decisions that move you closer to your goal of becoming pregnant. So that can be quite powerful. So I'd like to bring all together before I start taking your questions. So we talked about some modifiable factors today. I didn't talk about all of them, but I brought some of the most common ones. So think about your weight, check your BMI, and check if it's really within that fertility zone for weight, whether it might or might not be, but how does it reflect on your cycles? Do you have an ovulation? Do you have regular or irregular cycles? What can you notice about your body? And what decision can you make today to move you closer to where you want to be? Secondly, nutrition. If you reflect on what have you done over the past couple of weeks, is there anything that you would change taking what you have learned today? And I wouldn't say that you need to eat healthy all the time, but I would say that you need to eat healthy 80% of the time. Okay? So just think about what small changes could you make today that will have an impact a month from now. Will your cycles be more regulated, for example? Will you have better eggs, better sperm? What's the decision that you can take today that will have an impact a few months down the line, 1 year down the line? Secondly, physical activity. Are you doing too much, too little? Are you doing just right? Caffeine, up to 2 coffees per day. Alcohol avoidance if possible. And mindful, purposeful living. What can you do to live purposefully? So those were the 6. And as I promised you, I wanted to tell you about the enhanced fertility program that is happening on Monday. And this actually has been happening for a couple of years now, but on Monday we have our app coming, and we have all the 22 factors in our app, plus so much more information that is evidence-based information, support groups. All of this is absolutely free. And this is my way of giving back to this community, because as a nurse, I feel very frustrated that patients need to find information on Google that is not trustworthy. So over the last couple of years, what I've done is I came up with something that worked. I did several clinical trial studies to identify how best to reach you and write it in a way that you could understand and that could be very empowering for you to make changes in your life. So this is something that is coming on Monday. I'm super excited. So I would like to send an invitation. I'll send a link through the chat box so that you can all join me on Monday. If you want to download the app, you'll have access to a workbook that is also absolutely free. And there's another surprise that I can only tell you on Monday. Okay? And I would like to take all your questions today.
And as always, wonderful. Thank you so much, Andrea, for the presentation, for explaining all those details. And we are also very excited about the app that you have prepared with your team. And definitely, it sounds amazing. And we are very, very, very happy to have you here and to hear about this. And we are waiting for Monday, that's for sure.
Yes.
And yes, you are very right. It is time to start with the questions. And of course, as you can see, plenty of questions are coming up right here as well. So let's go ahead with the very first one. So it's in regards to your presentation, you have mentioned about the BMI. So my BMI is 25.5. And could it be a problem?
So you're just slightly above the recommended fertility zone for weight. So what I would like you to notice is whether it's having any impact in your body. Are you aware of any hormonal problems that you have? Any ovulation problems, irregular cycles? If the answer is yes, it could be that the BMI could be a problem. But if the answer is no, then it could be okay because it's just slightly above the recommended fertility zone for weight.
All right. Excellent. Thank you so much for your very first question, and of course, for your answer. Next question is ready as well. I like to make green juice with parsley and ginger and drink it daily. Is it a good habit when trying to get pregnant with IVF?
I think all of those things seem to be good. Parsley, ginger, they are naturally occurring products that are not processed. So I think everything that you can eat or drink that is poorly processed and it's a vegetable or anything that is healthy, then it can be quite good to give your body the right nutrients it needs to get pregnant.
All right, understood. Once again, thank you so much for that. Okay, next question is right here. I have a question about your own journey. Please feel free to answer or not. At the beginning of your presentation, you told us about your struggle. Did you find a way to create a family with choices that we have today?
Yeah, that is a great question. And I've struggled with that question. So I've been diagnosed 20 years ago. And at the time, I wasn't trying to get pregnant. I was just 17. But I do have a very big family. And I was hoping that one day I would have children naturally. So when that didn't happen, I think it took me a long time to come to terms with the fact that I would never be able to get pregnant. So the choices that I have today are either surrogacy, adoption, or not having children. Uh, and I've made the choice for now not to do anything. And this was an incredibly hard choice because I had the realization that none of the choices I had were like a band-aid to cure the wound of infertility. And they wouldn't take away the pain of not being able to carry my own children. So I think it's great to have choices, and the choices that we have or the choices that we choose to go ahead with need to feel right with us. And for me, just I don't think it's right for me at the moment. I think I'm okay with changing my mind. My husband and I, we talk about it every year in the beginning of the year, and we ask ourselves, how are we feeling about it? Do we want to pursue it, an alternative choice or not? And so far, for the last couple of years since we've been married, we've also felt I'm okay, I'm happy as I am. I don't want to face another struggle. So the choice has been no, I don't want to have another struggle, and I haven't gone ahead with another choice. I do have a husband, I'm very happy, and I have a puppy which keeps me busy. And I feel that my way of giving having my babies is almost what I've been doing as a fertility nurse by helping so many other couples have their babies. That gives me so much meaning, and that's what I have chosen to do.
Then thank you so much, Andrea, for sharing. Of course, this means a lot to many, many patients. So huge thanks for that. And of course, there is a thank you from our patients for you. And also, I wish you well either way. And of course, there's a suggestion maybe freezing eggs for the future would be good.
Yeah, I have thought about it. And at the moment, because it's been so long since I was diagnosed, my head is open to all those choices that are available. So I think if I ever decide to go ahead with surrogacy, I will deal with that. I don't want to think about the future. If I want to do surrogacy and my eggs are not good at that point, I will go ahead with egg donation. I'm completely fine with that, because for me, motherhood is more than the genetic connection with the baby. It's more about passing your values, your beliefs, and growing together. So, yeah, I'm not going to freeze my eggs for now.
Understood,
I
of
will deal
course.
mindfully in the present, and
Yes, of course.
I just believe whatever is mine will be mine.
Wonderful. Thank you so much for sharing again. Okay, and let's have a look. Next question is also ready. Will you recommend taking ubiquinol as a supplement? If yes, how much?
Yeah, so Ebucanol can be a powerful supplement. That is actually one of the modifiable factors that I talk about. So I think you can go to the app to check, but it depends on your condition, what you have been diagnosed with. So on Monday, go to the app, go to the supplement section, find ubiquinol, coenzyme Q10, and check if it fits with your conditions, if you should have it or not.
Excellent. Thank you so much for that. And there's another reason to check the app on Monday then.
Yes.
Wonderful. Thank you so much for that. And also, I just want to mention there is a big hug and thank you from the patient. Let's have a look. Okay, next question. It's a bit of a longer question. So, in Portugal, there was a study about the correlation of the consuming of alcohol during the week of academic celebrations
Mm.
and the quality of sperm. It was defined as reduction of this quality. But once men are able to produce sperm during their entire life, these effects of alcohol consumption in early days can impact after reduction of these consuming in late days. Anything you can
You seem
comment?
confused. No,
A
I
little
think I
bit.
understand, because I am aware of that study as well. Um, so what happens is that they've realized when men drink a lot of alcohol, sperm are very sensitive. So there was some impact on sperm, but men produce sperm since they've reached puberty almost throughout their whole lives, almost until they die. So once men start producing sperm, they will produce sperm every day. So there will be certain sperm that will be in the beginning stages of development, and there will be older sperm. So there's a whole process of spermatogenesis from a single cell to what you know is the format of a new sperm with the head, the midsection, and the tail. So as it forms into a big normal sperm, it takes 74 days. So they've noticed that men who were consuming that alcohol, they had changes in their sperm. But after a full spermatic cycle, which is the 74 days, the sperm came back to being normal again. So there's a chance of making changes to your lifestyle. If you are a man, if you stop drinking today or drinking less, then in 74 days, you will notice the differences in the quality of your sperm.
And thanks a million for explaining this one, of course, as well. And yes, there's another thank you for you from the patient. And let's have a look. Of course, next question is ready. I have problem with the thickness of endometrium, only 6-7 millimeters on day of ovulation. Is there anything what I can do to solve this problem? Maybe food enriched with estrogen?
Yes, so the hormone that impacts the thickness of the endometrium is called progesterone, and it's produced by the corpus luteum. So when your eggs are developing in your ovaries, the eggs are inside the follicles, and we have hundreds of follicles developing with eggs inside in every cycle. And there is one egg that will be fully mature and will be ovulated. Okay? And all the other eggs will degenerate. Once the egg is ovulated, the follicle that was around it will become the corpus luteum. And the corpus luteum will produce the progesterone that will prepare the endometrium lining to receive the implant, the egg that has been fertilized. If the thickness is not enough, that could be one of two reasons. Either the corpus luteum is not producing enough progesterone, in which case you could either take progesterone medication or you could receive certain medications to induce ovulation and create bigger follicles that would then create more progesterone once the follicle becomes corpus luteum. Or the second problem might be that the endometrium is not responding to the progesterone that you are producing. So this is a very important distinction to make. You need to understand what is the reason why the endometrium thickness is not enough. So I would say probably measuring your progesterone levels would be the next step to understand whether you're producing enough progesterone or not during that phase of the cycle.
And wonderful. Thank you so much again for that thorough explanation yet again. And there are like two questions remaining. So, of course, we will be slowly finishing. So, if you have any questions left, go ahead and type those in right now. And the question is, recently we had a failed ICSI cycle because we had 7 eggs retrieved, 3 were viable but none fertilized, unfortunately. What can I do? Could it have been the protocol and stems I was on, or is it more likely to be the quality of the eggs and sperm?
So if you have 7 eggs, 3 were viable, but none of them fertilized, even with ICSI, that tells me that it's likely to be the quality of the sperm or eggs. There's something there that is preventing the egg and sperm to fertilize. Because in ICSI, what they're doing is they are putting the sperm inside the egg, but they still need to react and recombine their DNA to develop into an embryo. So that leads me to believe that it might be the quality of the eggs and sperm.
All right, understood. And actually, there is another question from the very same patient. So, how can I know the quality of my eggs? I have a regular cycle every month. What type of signs could imply good eggs, for example?
That is such a great question because we usually talk about the quantity of eggs and we can sort of ascertain the quantity of eggs with certain medical tests, usually AMH and an antral follicle count ultrasound. However, how good the eggs are, there's only one way of seeing it, and is whether the eggs are fertilized or not. So there is no other way of knowing. And I understand that these eggs didn't fertilize, but before we assume that the problem was in the eggs, we need to look at the sperm as well. Was the sperm normal? So was there a DNA fragmentation done on the tests? Were they absolutely normal that we can say that the problem is with the eggs? I don't know. But the only way of knowing if the eggs are viable is through fertilization rates.
All right. Again, thank you so much for that. And there is a thank you from the very same patient. Thank you for the info. Really appreciate it as well. Okay. And next question is, do you believe you can change a quality or is it fixed?
I believe you can change it because we are born with 1 to 2 million eggs. So when we are babies ourselves, we already have 1 to 2 million eggs. By the time we reach puberty, we have around 400,000 eggs left only. Every month, we're losing lots of eggs. These eggs are in a sleeping state in our ovaries. So every cycle, there's a certain number of eggs that will grow and mature. It's not like they're all ready ready to be ovulated. So they need to grow and mature in every cycle. So the things that we're doing with our nutrition, with our lifestyle, the products that we are putting in our skin, our physical activity, all of those things can impact the ability of these eggs to grow and mature properly, to have a better quality, to be ovulated, fertilized, and to generate into a healthy baby. There is an amazing book that talks about egg quality that you should read. It's called It All Starts with the Egg, and it has so much good information about it, all evidence-based. So I highly, highly recommend that book.
All right, again, thank you so much for that. And let's have a look. Next question is right here. So, on which days of cycle the progesterone should be measured regarding the previous question of endometrium thickness?
So we are ovulating, and then you need to allow a couple of days, and then you should measure your progesterone. So here it means that in order to identify ovulation, you need to do one of two things. Either you have a scan when you think you should be ovulating, and the doctor identifies, yes, you're ovulating, come in a couple of days to take some blood and measure your progesterone, or you're using an ovulation test, like measuring your LH in your urine, so you know you're going to be ovulating in a couple of days, and then you allow another couple of days, and then you measure your progesterone. And then at the same time, you can do an ultrasound to measure the endometrial thickness as well. So that would give you the full picture of what is happening during that stage of the cycle.
And excellent. Thank you so much once again for your question and your advice and your answer to that. And can you comment on this? Is it normal to have a cycle that vary 28 to 30 days? Why does it happen?
Yes, so a cycle of 28 to 30 days. So that means that this month you might have 28 days, the next cycle might be 30. It's absolutely normal to vary a couple of days from cycle to cycle. If you do vary more than just a couple of days, so let's say this month was 28 and next month is 40, that is not normal, and you need to understand what's the reason. But if it's just a couple of days, it's absolutely normal. And the main variable phase of the cycle is that phase between before ovulation, when it's just very variable from women to women, and even from the same women from cycle to cycle. We know that the luteal phase, the progesterone phase, lasts between 12 to 14 days after ovulation, but the phase before ovulation, it can be quite variable. So, and that brings that variety of a couple of days, but it's absolutely normal.
And once again, thank you so much for that explanation. And there's a thank you from the patient. For now, at least, it looks like that might be our last question. And sorry for asking so many questions. No problem at all. Is it possible to take too many supplements that then have an adverse effect on the quality of the sperm and egg?
I'm not sure, is the honest truth. I'm not sure if you have the chance of having an adverse effect on the quality of sperm and egg, but you can have an adverse effect on your overall health if you're taking more supplements than it's the recommended dose. That's why it's important that you look at the labels and see what the supplements have. Some supplements might come in a form of a multi-supplement where they have a lot of items in it. And then if you're taking something else that also has, for example, the same vitamins in it, you don't want to be doubling up. So read the labels and just take the recommended doses.
And wonderful. Thank you so much once again for that explanation. And at least for now, I do not see any questions. However, someone is typing, so let's wait and see. But of course, we will be slowly finishing. So already, I would like to thank every and each of you for joining us tonight, for your questions. And Andreia, as always, it's great to have you. So thank you so much for joining as well. And well, thank you for your advice, your recommendations. It's always a pleasure to be able to cooperate. That's for sure.
Thank
And
you.
there are more thank yous coming up. And could you send us the link for the app again? There's another question. This is in the chat section, but of course,
Yeah,
it's
I've just sent it.
possible. Perfect. Thank you so much for that. So we can definitely encourage everyone to just have a look at the app. And as you know, it will be launched on Monday. So
Yes.
I am definitely happy to hear that and that you are able to be with us and tell us that we should be looking out for it on Monday. And well, as you can see, there are more and more thank yous coming up your way, Andreia.
Thank you. Thank you so much for being here today.
Excellent. Thank you so much, everyone. And I just also want to mention that remember, it has been recorded, so you will have a chance to re-watch this again. You can find it on myivfences.com. And if you go to the website, you will be able to see that there are other previous webinars with Andreia there as well. And if you simply go to our YouTube channel, you will be able to see all of those past events. And I also would like to encourage you and just simply go ahead and register for our next events. As you know, we will be back tonight actually at 8 p.m. UK time. So I hope you will be able to join us as well. Andreia, as you know, it's always great to have you. And I know this is not our last webinar. So looking forward to the next one already. Thank you so much. Have a lovely
Bye.
evening, everyone. Take care.
Bye,
Bye.
everyone.
Bye.